All right, as everyone is entering, I'm going to welcome you. My name is Erin Shea. I am a branch supervisor for the Ferguson Library and very excited to have you here tonight on Zoom. Thank you for coming and attending with us virtually. My colleague who's here to introduce our guest speaker, I'm going to introduce him. His name is Joe Belisle. On my screen, he's below me, although I don't know if he's below me on your screens, but Joe Belisle is the coordinator of the Kids in Crisis LGBTQ youth group. Joining me in welcoming Joe.
Thank you, Erin. Thank you so much. Thank you, everybody, for joining us tonight. I'll be quick. I just want to say a little bit about Lighthouse. Lighthouse, as Erin said, is an LGBTQ youth group. We currently are meeting at the Avon Theater in downtown Stamford through COVID. They were gracious enough to loan us a space, but we are an LGBT youth support group. We are really social in nature, and all LGBTQ youth are welcome to come, and their allies. We meet every Tuesday night from 5 to 6:45 at the Avon Theater, and we serve a free supper. So it's very social, very relaxed. It's a warm, wonderful group of kids, and everyone is welcome to come. Tonight, we have a very special speaker that I'm honored and privileged to work with. Her name is Michaela Scully. Michaela is a licensed clinical social worker who has worked at Silver Hill Hospital for over 7 years, as well as in private psychotherapy practice. She is proficient in mood disorders, co-occurring addiction, eating disorders, family systems, LGBTQ individuals, as well as dialectical behavioral therapy and cognitive processing trauma work. She has a history of advocacy she has done on behalf of the LGBTQ community, including policy development within the hospital, developing an LGBT group for patients, and offering education and support at Silver Hill as well as beyond the hospital. She currently facilitates a peer support group for transgender and gender nonconforming youth at the Triangle Community Center in Norwalk. Michaela lives with her partner in Black Cat Jack in South Norwalk. Welcome, Michaela, and thank you so much for being with us tonight. I'm going to turn it over to you.
Hi, thank you, Joe, and thank you, Erin. Thank you so much for having me. And I have had the privilege a number of years ago now of being able to come to, I think, a couple of Lighthouse groups when we were at different locations. Hopefully I'll be able to see Avon in the future. That's very cool. I love that place. So I'm thrilled that you're able to use that space now. I love that. So yeah, I am here to talk to you guys a little bit about the LGBTQ community. And for many of you, I know this will be possibly preaching to the choir. And for some of you, it might be very new. So bear with me in terms of what you already know, in terms of what you don't know, and hopefully we can come together and have a good discussion. I'm going to refer to some slides towards the beginning for maybe 20 to 30 minutes or so, and then we're going to actually look at a couple of examples of different role plays and look at those together with Joe and Erin and have some discussion about those. And we encourage questions. We want to make sure that you guys have an understanding and really are able to talk about how we can support LGBTQ youth and support this community as best we can. That's really the goal. So give me one moment while I share my screen. Give me just a second. Okay. Give me one moment. For some reason, it's saying it's invalid.
Take your time.
Let me just reopen it again.
So we'll have some time for questions after Michaela's presentation, and then, but like Michaela said, we're going to do a little role play afterwards, so indulge us after this, and then we'll open up. You can type some questions to us, and we will see them and answer them for you. Welcome to the technical age of COVID.
We did it perfectly fine the other day,
Yeah.
so we should be good.
It'll happen.
All right, we good now?
Yes.
Perfect.
We can see it. Thank you.
Yeah. Got
All
it.
right. Perfect.
We're
So,
gonna
all right, excellent. So, all right, I titled this Understanding the Challenges and Rewards of Finding Identity in the LGBTQIA Community. We'll talk about what that means, and that's me down at the bottom if you ever need to email me for anything. I welcome that. Some of the objectives here, starting with introducing terminology related to the community, and really I want you all to have an understanding of the differences between gender identity, gender expression, and sexual identity, to three very key differences that I feel like everyone should really understand. Also, being able to identify any biases, fears, misinterpretations surrounding individuals' expression of gender identity and sexual identity, including but not limited to, what kind of expected social behavior do you expect certain people to have? What sexual behavior do you expect certain people to have? What attraction do you expect certain people with certain labels to have? And also gain an understanding of issues unique to gender and sexual minorities and how we can support those we love and people in the community. So to start, the acronym that most of us see all of the time, LGBTQ, the Q is the more recent add-on, so we'll talk about that. It's the acronym that we see the most to describe sexual and gender minority population, including lesbian, gay, bisexual, transgender, and queer or questioning. We will talk about the queer word a little bit further. Although this acronym is primarily used universally, and like I would venture to say that you can feel safe using this pretty much anywhere. However, it is still important to understand that many still feel unheard because it's not all inclusive. There's literally no way in the alphabet soup of LGBTQIA, there's no way to fit everyone in that. And most people in the community understand that. No one's really expecting to have every single one in there. And that's why we have more umbrella terms, such as the queer community. So, you know, you might use sexual or gender minority population. Some people still like gay community, even though that isn't necessarily all inclusive either. Some people feel very comfortable with that too. So it really just depends on the person. LGBTQ is probably your safest bet still. Okay, so we'll start with sexual identity. So sexual orientation or identity, people still use the word sexual orientation. I prefer the word sexual identity because that's really what it is. It's more of a label, how we're labeling ourselves, how it is how we're oriented. However, it's more how we are identifying. We're putting the label on ourselves. Identity, attraction, and behavior, however, it's important to distinguish that the three of those are not always the same. So someone might identify as bisexual, they're dating a woman. However, you know, they still have attraction to both men and women. So the behavior might be confusing to people. What? I don't understand. How could you have attraction to both men and women? Well, this person identifies as bisexual. They can be with a woman and still have attraction to both men and women. That's, you know, that's just one example of that. Or an identity of someone identifying as gay, the behavior is they've only ever dated people of, like say it's a woman who identifies as gay, she's only ever dated men. This is possible because perhaps she was socialized, as many of us have been, that being heterosexual is what is the quote unquote normal and right thing to do. And that she tried before she realized that that's not what felt right for her. And she just has not dated a woman yet, or doesn't want to. So behavior doesn't always match up with identity. And that's something that is super important in terms of not making assumptions about people. So attraction is largely out of our control, but making sense of it is affected by socialization and self-awareness, while labeling one's self-identity is up to us and our own comfort level. And if we want to do that, we don't have to, but we can do it to maybe help us find community. We can do it to help us feel a sense of security, but we don't have to do it. And acting upon it, behavior, is of course up to the individual's discretion. Someone can have a sense of attraction and of course never behave or act on that. And someone can have that attraction and not yet have labeled that identity. So hopefully that made sense. A few types of identities, ones that most people have heard of at the top: lesbian, women attracted to women; gay, man attracted to a man. Women also use this term, of course. Women attracted to women, sometimes used as an umbrella term, as I mentioned, for the entire LGBTQ community, like the gay community. Bisexual, a person who is attracted to both men and women, and it's now used as more widely as people. It used to be seen as like people who are pansexual were attracted to people regardless of gender, recognizing the potential for multiple gender identities. That is still true. However, pansexual is something that's really under the bisexual umbrella. People who are bisexual aren't like discriminatory against transgender people necessarily or anything like that. It really is a word choice type of thing, what someone feels really describes them better and that they understand themselves better. Asexual, an absence of sexual attraction or interest in sexual activity, obviously something that doesn't have to do with, trauma or something that has to do with, some sort of medical anything. It's just the way that someone is and the way that someone is consistently. And there's a lot of people who are skeptical about this, and there are people who are in fact uninterested in sex. And we'll get to queer, as I said. Also important to understand that sexual identity and gender identity are two very completely different things. I think these get confused because the LGBTQ community puts transgender people with something having to do with gender is thrown in to these letters that have to do with something having to do with sexuality. There is a large historical context that has to do with that I'm not sure I have time to get into this evening, but they are separate entities, and sexual orientation and gender identity are interrelated, but not interconnected, okay? So it is important to understand that a lot of this, the reason why people overlap them is that we are really bred into a culture of heteronormativity that naturalizes people who are straight as this universal, like this is the way everybody should be. And even when different gender expressions or sexualities are acknowledged, people say things like, well, who's the man and who's the woman, or things like that. Like that would be an example of heteronormativity. Right? So we can conflate things like gender identity and sexual orientation because of that, right? So for example, a transgender woman who's still attracted to women, people tend to be completely flabbergasted by this. Like, well, why would you still be, why would you become a woman if you're still going to be attracted to women? As if someone changes their gender to somehow become straight, as if that was the goal, when really how someone feels about who they are and their sense of their gender identity has nothing to do with who they are attracted to. An easy way to think about it is that's been described to me that I like is Gender is, you know, and this is a minimizing way to think about it because it's sexual, but gender is who you go to bed as, and sexuality is who you go to bed with, so to speak. So that's just one way to think about it. The idea of heterosexism is a belief in the superiority of heterosexuality over other sexual orientations. That's very ingrained in American society, other societies as well, certainly. And the systematic privilege that heterosexual persons gain while oppressing the LGBT community. That can be expressed in a lot of different ways. But really just this idea that like, oh yeah, of course it's like ideal to be heterosexual. And I would venture to ask, well, why is that? Well, oh, it's easier, or oh, you can do this and you can do that. And really there's a lot of different reasons why we've just gotten used to that over time and not necessarily have a definitive reason why. This is a genderbread person, and this is a very descriptive genderbread person. I'll start with the less descriptive genderbread person. I just like visuals. We started talking about identity and attraction. So identity has to do with how we feel, what we are inside. That comes from us. Gender identity. Attraction is who we are emotionally attracted to. Sex is anatomical sex. This is what we were born as. In terms of the physical traits that you're given in development, the sex characteristics that usually assign us male or female at birth, or intersex, which used to be called hermaphrodite for some people. We don't really use that word anymore. So we usually assign people a gender based on external genitalia. We don't tend to look at other things like chromosomes, hormones. Like, we don't tend to look at those other things. We just tend to look externally, and we make an assumption based off that, and we roll with it. And sometimes we're correct. Most of the time people are correct, and sometimes we're not correct. And gender expression really is how we are on the outside, how we're expressing ourselves on the outside, everything from the clothing, our demeanor, a name we might choose, our presentation, anything, any social expectation that might be in alignment with something that's more masculine or feminine, that has to do with our gender expression. And as you can see, we can be on these scales of not just masculine on one side and feminine on the other, but somewhere along the line on both. So I really like how this expresses that, because it's not an either or type of situation for anyone, truly. No matter whether you're in the LGBTQ community or not, this is really a chart for everyone. And if you want more resources like this and some more videos that explain a lot of things like this, go to, you can see at the top, it's pronounced metrosexual.com. He's got a lot of stuff like that. I really like this Monty Python Meaning of Life. If anyone's seen this movie, is it a boy or a girl? I think it's a little early to start imposing roles on it, don't you? So that goes back to what I was just talking about in terms of assuming gender based on biological sex. And of course we do. It makes perfect sense that we do, because most of the time we're right. So why wouldn't we? And it's just important to acknowledge that sometimes we're wrong, and that's okay, that sometimes we're wrong. And it's also important to recognize that 1 in 100 births are intersex people whose sexual or reproductive anatomy are not considered traditionally male or female. That's a lot of people. Like, most of us probably know someone who's intersex, whether you know it or not, or whether they've ever told you or not. And that person, you know, there are people who have had to be forced to have surgeries when they were babies. There are people who have, women who have had testes that were not distended. There are all different types of presentations when it comes to people who are intersex, different types of chromosomes. There's all different types of presentations. And that can be confusing in terms of gender presentation too for people. And gender identification. So anyone's self-identification as male, female, or genderqueer, gender nonconforming. So genderqueer, we're going to talk more about that. I keep putting off queer, but I feel like that serves its own. So again, sex is a component of gender, but not a determinant of gender. I just really like this image. I feel like it's super helpful in understanding gender expression. This is the same person from the top left photo to the bottom right photo. It's the same person. The only thing that's different is their clothing and how they've styled their hair and makeup. That's the only thing that's different. They're the exact same person and styling. So gender expression can say a lot about how someone wants to share themselves with the world and what they want to tell the world. And so for some people, it's incredibly important, and for some people, it's less important. It should be something that people are allowed to explore, though. I think it's very important for people to explore whether they are just a more artistic person or whether they need to feel secure in their sense of self. I think this is a beautiful project, and I think it just shows the diversity to which any of us can really evolve in our gender expression. So there are some people who, this is just gender expression. It says nothing about your gender identity necessarily, unless you ask someone, like this person might be genderqueer because their presentation is so androgynous. However, I don't know that for sure. Someone can present incredibly androgynously and still identify on the binary of male or female. They might not be gender non-binary or gender non-conforming. I wouldn't know that unless they shared that with me or I asked. I try to not assume what people's pronouns are, and I usually try and use gender neutral pronouns if I don't know. Notice that I said they when I was referring to this person because I'm not sure. A lot of people say he or she. I just like they because it applies to everything. If you look at apps now, if you look at different things on social media, even Facebook, like if there's not a designated gender, it will say they. Like things are catching up with that. We just have to catch up with it. Like they posted a blah 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 blah. Like we just have to catch up. So many of you know this as well. Transgender is an umbrella term for an individual that has gender identification that's not associated with their assigned gender, which was usually had to do with their biological sex. For example, someone who is assigned male at birth, who identifies as female, is a trans woman. And grammar is important here. We're not going to call somebody transgendered or a transgender. It makes somebody an object, or it makes someone, or it makes somebody sound like a disease by saying transgendered. So that we really, for obvious reasons, don't want to do that. And I can understand why it's confusing. Like you can say a lesbian, but you know, you don't say a transgender. So it's, you know, there's wiggle room for learning, certainly. Transition, the steps a trans individual takes to present as their identified gender, not assigned gender at birth. This might include solely outer gender expression, or it might include medical transitions such as gender affirming surgeries, hormone therapies, puberty blockers, etc. We don't really use terms like M to F or M to F to M anymore, but medical, like hospitals, still use those if, you know, just for clarity, especially when legal names are still on records and things like that. genital surgery remains out of reach for a lot of people, and some really don't want it. Therefore, surgery should never be a requirement for somebody's rights or somebody's respect. A lot of people say things like, oh, have they had surgery? Or, oh, have they, like, is somebody a real X, Y, and Z? Are they a real man? Are they a real woman? Like, these are ridiculous questions to me. And someone should be treated as human and is exactly who they are, no matter what stage or if they are at no stage of transition. Cisgender is what most people in the universe are. Before there was the word heterosexual, there was the word homosexual, and then there was no word for heterosexual. It was just everybody else. And then they created the word heterosexual. Then there was the word transgender, and then it was just everybody else. So then they created the word cisgender. Gender identification that's typically associated with your biological sex and assigned gender at birth. So if you identify with the gender you were assigned at birth, then you're a cis woman. A woman who was assigned a female at birth is a cis woman. Two-spirit are Native American, American Indian, First Nation terms for those who blend masculinity and femininity. These individuals have been historically accepted and often revered in their Native communities for crossing these gender boundaries. Not so much depending on where you are now. I mean, Native populations have a lot of difficulties depending on where they are for various reasons. But I just think it's very interesting that historically these individuals were not discriminated against, but revered for their ability to see multiple sides of the spectrum. This idea of having a chosen name for trans folks is something that they've given themselves to more accurately express gender identity rather than their given name, which was given to them at birth that coincides with their assigned gender. I've heard plenty of people who want to change their name, even if their assigned name or their legal name, if they haven't changed it yet, is pretty androgynous or gender neutral. Like, people just don't want the association with their old life. Things not to say, don't say like, oh, what's your real name if someone gives you their chosen name. Talked about pronouns. Pronouns should be respected. I see no reason not to respect somebody's pronoun. Like, I don't really care how much you question someone's validity of their quote unquote of their identity. It's not up to you. And honestly, people do explore and try things on before they settle, and they should be allowed to do that. And you respecting wherever they're at in their process is not going to make or break wherever they're at in their process. So if you respect that, it's just going to help them in their process either way. Okay, finally, this slide that I was pushing back. Queer is a reclaimed, self-affirming term for those who fall outside of the gender and sexuality norms, with different definitions depending on context. So it can be used as an umbrella term to describe the entirety of the sexual and gender minority community, like the queer community, widely recognized socially and academically. When I was at Syracuse University over 10 years ago, they had a queer studies major, and it was there for a while before I was ever there. Yeah, are there people who still don't like the word queer? Sure, but don't call them queer. You can say that there is a queer community. That is a universal truth. And you're not going to call somebody's individual sexual orientation queer unless they do. That's it. An individual sexual orientation that they feel does not neatly fit within another category, or just choose not to more specifically categorize their sexual orientation. Like, I personally identify as a queer female. My sexual orientation, I use queer. I really like the word. I like the reclaimed word. I like the ambiguity of it. I like a little bit of the rebelliousness of it too, historically. And also that, you know, you kind of need more information. It's mine and my partner's business kind of thing. So queer can also be referring, as we mentioned before, to gender. So that's why it's depending on context, right? So I like this cartoon. Are you a boy or girl? No. It's perfectly appropriate when discussing someone's identity to ask them what queer means for them. They don't have to answer it though. That's okay too. Like you can say, what does this mean for you? And they can say like, I don't really want to share that. That's okay. That doesn't mean you offended them either. It's yeah, but I think it's completely appropriate to ask somebody when they say like, oh, identify as queer, like say like, oh, so what is, you know, what does that mean for you? So we're wrapping up soon. If someone's description of themselves falls into one of these terms, it doesn't mean that they identify with the term. There's multiple reasons for that. They might not know the term, or they've chosen not to identify with the term, and that's fine. But that person may want to explore whether or not that has anything to do with internalized homophobia, and it may or may not. Sometimes people don't want to utilize labels, and that is a perfectly healthy thing. And sometimes people don't want to utilize labels because they really don't like themselves or feel like it could be an unsafe situation for them, whether it's at home or at school or anywhere else, or they feel like it could even be emotionally unsafe to admit that to themselves. And spaces like the Lighthouse make it more emotionally safe to talk about these things and make it okay to even consider the thoughts and the emotions that we're having. An individual can identify or not identify however they feel comfortable with and whatever empowers them. Attentiveness to the LGBT community should not only apply to those who have already told us that they're in the community. We can't predict if anyone is going to be in the community, so like we should always be respectful of LGBTQ people all the time. For example, if you hear a group of people at one of your family gatherings like making fun of a queer person or an LGBTQ person, there is a high likelihood that there is someone in your family gathering, whether you know it or not, that probably identifies in the spectrum of queer. And if you are able to say something about it, and if you are able to shut that down, you could really have done something potentially even life-saving for somebody else in that moment. And that might sound dramatic to some people, but we have a lot of statistics that show that can be true, and I'm going to get to that. Many might not know also, if they identify in the community, they might not be in an environment that is allowed for self-exploration that even has shown them that these things exist. This is where I'm getting to this. Are there more queer people now than ever, more than ever? There's more resources for people to understand what being queer is, and that queer people exist. There's the internet. There is people actually discussing it in the media. People aren't sitting there in pain and waiting until they get to college or waiting until they're done with college to be themselves anymore. Now, openness and curiosity is expanding culturally, and that is both a beautiful thing and also frightening because it's not going so well for everyone. There are some people that it puts them in a more dangerous situation in their families because of that, whether it's just like emotionally, their families don't understand, how could you possibly think this early in life? And then there are other people who just don't quite get it and don't feel heard or seen, and they typically wouldn't have talked about this until many years later. So we want people to feel equipped to be able to talk about this with people at earlier and earlier ages, when it never was before. Can someone make someone else queer? No. No. Are you sure? Yes. Someone might be exposed to someone who's in the queer community, but that cannot make them feel feelings that are not there. Questioning and exploration of sexual and gender identities is a natural phenomena, and as long as it's done safely, should be supported. If your child or someone you know is attracted to wanting to hang out with queer folks, there's a reason for that. There's something going on there that they want to even be around those folks, okay? Just quick before we end, I'm gonna look at this really quick because I think it's really important for people to know about family rejection and risk for suicide. Low rejection has a much lower risk for suicide, direct correlation. High rejection, a much higher risk for suicide, 8.4 times more likely people are to have attempted suicide, LGBTQ young adults who are rejected by families in adolescence. Family acceptance during adolescence and perceptions of being a happy LGBT adult. Level of, so this is the bottom left, extremely accepting, 92% level of happiness with families who are accepting, not accepting at all. People rated 35% happiness. Direct correlation with family acceptance. As you can see, moving over, higher risks for HIV, higher risks of depression, more likely to engage in risky behavior. Challenges, there's a lot of challenges, which is usually what gets families in the way, like, oh, I don't want my kid to be misunderstood, discrimination, fear, loss, self-doubt, dealing with minority stress, but there's so many rewards as well, such as finding pride in your true self, community, feeling heard, feeling understood, and finding love in community and otherwise. So being humble is important, cultivating a non-judgmental and unassuming attitude, listening and validating experiences, allow for exploration and creativity with gender expression. Check out the book, This is a book for the parents of gay kids. Ask yourself, was what I'm about to say going to potentially help or harm my relationship with this person? Looking at intent versus outcome. Educate yourself and support yourself. Books, internet. If you're a parent, definitely check out PFLAG. There's a great one through Norwalk. It's on the Triangle Community Center website, but PFLAG Norwalk has its own website as well. Becoming a visible and active ally. I could do an entire presentation on what it means to be an ally, so we'll have to stop, but I will give it to Joe now. Yeah.
Thank you so much. Thank you so much. That was awesome. So we're going to have questions. I'm going to open up for questions in a minute, and feel free to type them to me, at anybody who's on. But I want to do a little bit of role play, and I wrote out some scenarios that I've heard in this past year from told to me by kids or parents have said to me, and I just want to act out a couple of things. Aaron and I are going to act out a couple of things, and I just want Michaela, our professional therapist, to comment on our exchange. So Aaron, why don't you start with the first one?
Okay, I'm Sally and I'm acting, which is something I have barely done in my life, but here goes. Mom, I think I'm attracted to girls.
What? That's a phase, honey. You'll grow out of it. It's probably because you've been hanging around with too many tough girls. You just need some better friends. Michaela, what do you think?
Well, it's very sad to me, first of all, that you've heard this within the last year. Because me
too.
Of course, people are still saying this.
Yep.
But just needing some new friends is it's incredibly invalidating. And hanging around with too many girls tough girls. It's just basically telling someone that multiple aspects of who they are is wrong. The choices you're making are wrong. The things you're feeling are wrong. The types of people you're hanging out with are wrong. The types of choices that you're making are wrong. Like there's a lot to be left with to feel lost in that kind of situation. And the last thing that a child is looking for in that moment is to feel more lost than they already feel. I mean, I don't know how old this person is, but it really doesn't matter, because I think you can still feel lost whether you're 10 or 17 or 35 in this type of situation.
Feel even more alienated.
Completely alienated. It's like, okay, am I supposed to now completely try and change my entire life to fit my mom's needs, or am I trying to like, or do I no longer, what do I do? Do I deny who I am as a person, or do I risk losing my mom? Like there are so many questions here that
lose for the kid.
Sorry?
Lose for this kid.
It's a lose. Yeah, it's a lose. Like there's so many questions about what happens next that I think are frightening.
Yeah. Okay, thank you. Erin, scenario 2.
Okay, now I'm Jimmy.
Yep.
Dad, I want to go to Lighthouse, the LGBT teen group that I heard about in school.
For what? You're not gay. No one in our family is gay. Michaela, what do you think of that? Heard it this year.
No one in our family is gay. Well, first, it kind of is interesting because it makes me feel like that person does believe in the fact that there is a genetic component to being queer. So I'm like, okay, there is, yes. Let me be a little strengths-based there. And at the same time, it doesn't sound like anyone who is gay in that family would ever want to tell anybody about it if that was the reaction. And also, of course, there does not have to be anyone else in the family who identifies that way or has those feelings for those feelings to be legitimate. Of course, you want to be able to explore whatever it is you're feeling, even if no one else in the family has ever had those feelings. And also just to say you're not gay without asking, like, what are the like, okay, like what are your interests in that group? Like you don't even know if the kid wants to go because their best friend is gay and like they want to go as an ally. Like you don't know if there's something else going on. There's just the automatic assumption of what, you're not gay. It makes me wonder what fears the parent has that are being reflected here. So
yeah, you're right. Okay, excellent, thank you. So this next one I'm just gonna read, and this is Aunt Sue talking to her niece Katie, who is 15 years old. Katie, your mom tells me you think you might be a lesbian. I just want to tell you that I'm personally fine with that, and I support you. But just don't become one of those bull-dyke lesbians. I hope you'll always be pretty because you're pretty and you should own it. Heard that. Heard it. In the group. Professional therapist, what do you say?
I so appreciate that these are real examples, because otherwise I would be like, Joe, this is a little outdated.
No, I didn't make any of this up. I have made none of this up. I've heard it.
Oh my gosh. Yeah, that's rough. That's really rough. Yeah, I've heard that too. I mean, it's this idea, there's so many stereotypes. There's so many like gay stereotypes of like what it means to be a gay woman, and like that this eradication of femininity and this crossover between, that's why I feel like that those bubbles of like gender and sexual orientation need to be so separated, because yes, like I think that when you have something like an attraction to someone that is not heterosexual, you already are not the norm. You're gonna play with gender a little bit. You're gonna play with these things, like you're gonna be more in alignment with playing with your gender, your sense of expression of yourself. And some people weigh more on that than others. However, it doesn't say anything about like who your gender, or it doesn't say anything necessarily about like how much you're going to change. It's complicated and it's very simple at the same time. And just this idea, it's just incredibly incredibly invalidating that this person would just say like, okay, you feel this way and it's going to make you ugly, or it's like people like that are not pretty, people like that are not seen well in the general.
Stereotypes are alive and well. Stereotypes are alive and well in 2020. They're alive and well. And,
Yeah.
and we hear them, and I hear them reflected from the kids who come to our group. I officially want to invite you to our meeting soon, Michaela, to come, and I just want you to help me give the kids talking points to deal with real life situations that we hear, because my head explodes on a weekly basis. Yeah.
Okay. Yeah.
So we'll have you soon. Okay, I have one more scenario, and then we're going to get to some questions. If you have a question, type it. If we don't get to your question tonight, you can email me. I have a really easy email. It's lighthouse@kidsincrisis.org. lighthouse@kidsincrisis.org. You can email me. I will get in touch with Michaela. I will get in touch with, if you need help through any of the expert therapists or referrals from Kids in Crisis, we will get you that help. So this is going to be the last scenario, and then I'm going to read some questions. Okay, Erin, you start. You're my wife. Go ahead.
Mm-hmm. Honey, Jimmy just told me that he thinks he's gay. I think we both knew that, but maybe we can get him some help and change his ways. What does the American Psychiatric Association have to say about that?
Well, I just looked it up, and here's what they have to say. The American Psychiatric Association does not believe that same-sex orientation should or needs to be changed, and efforts to do so represent a significant risk of harm by subjecting individuals to forms of treatment which have not been scientifically validated, and by undermining self-esteem when sexual orientation fails to change. No credible evidence exists that any mental health intervention can reliably and safely change sexual orientation, nor from a mental health perspective does sexual orientation need to be changed. That's what the American Psychiatric Association has to say. So, yeah, thank you for that presentation again, Michaela. And it's, eye-popping, some of those statistics. The 8.4 more times for attempted suicide. And I would just like to reiterate that family acceptance is everything. When you're a 14-year-old kid trying to figure out your sexual orientation, your home environment is everything. You are, the wind beneath your child's wings, to say a trite, quote, trite song, an old song, but you really are. And, you're everything to your child, and the support at home, whether they get it or not, it means everything, and it determines so much about their situation. So, at Lighthouse, we are all about two things: acceptance and the power of listening. So any kid who comes in the room, know that you will be listened to, and know that you will be respected. And, you know, that's what the group is all about. So let's see. Yes, the Kids in Crisis Helpline is 203-661-1911. That is open to anybody with any problems, big or small. Any of our kids can call, parents can call that number. So that's an important number to remember. And you can always go to our webpage too if you need to see that number again. Here's a question from Claire. My child recently told us they are non-binary. We, mom and dad, are working on using the right pronouns and honoring expression through hair and clothing choices. After the initial revelation, we haven't gotten much more information. Any suggestions for additional ways we can be supportive? Kayla?
I love that. First of all, I'm really glad that you're willing to allow for the exploration, especially through, you know, like very healthy ways. I mean, there are a lot of parents who are like, oh my God, hair. It's hair. It'll grow back. Like it's okay. It's very healthy to be allowing for that. Don't be afraid to ask. It might be very interesting for your child to hear from you, like, hey, you know, you brought this up, but we haven't talked about it. I'm just, you know, I'm curious. I want to know how you're doing. And, you know, not in a strange or voyeuristic type of way. And I'm your parent and I care about you and I want to know and learn. And you might get a kind of teenage response like, no, I don't want to talk about it. And if you do, that's great, because then they see it as something as normal as everything else. And if not, then maybe you do get to talk about it some more. But asking your child like what I can do to help for some is like an anomaly, and it's like, what? Like, you care about what I think and like what I want? It's very strange for some, and if you continue to do that, I think they would only appreciate it. And I love that you're working hard and trying on the pronouns, and just keep going. And if you haven't checked out like PFLAG or other resources for yourself, like keep doing it. And I hope that they have some support and peers as well. So yeah.
Great. Another question. When I'm advocating for my team, I find that adults, teachers, doctors, etc., are sadly uninformed. I try to educate them so that they will know what is appropriate to say. Do you suggest, what do you suggest about what to say to these professionals who really have no understanding of the LGBTQ community?
Oh my gosh, that's so hard. I think, I mean, it would be helpful to know, you know, if it's specifically a trans teen or, you know, a bisexual teen or a gay teen. I mean, I think that there are different levels of understanding for different aspects of the population, of the LGBTQ population. But in any case, I think it depends on what your, don't understand pronouns and name change. So if you're able to have a meeting with them, or if you have anyone in that person's life who is working with them, like if they have, like maybe they don't have a therapist or don't need a therapist, if you have a therapist who can make some of these calls for you and have some of these difficult conversations and do some of this advocacy work for you, that might be able to help, because it can get exhausting for you to do this over and over again and continue to educate, you know, all of these different realms of your child's life. See if you can find a school social worker maybe who like gets it, and see if they can be an advocate or a resource for you, because that would just be fantastic. And yeah, just see if there's even like a teacher that your child really likes or like seems to really get it, you know, because that one teacher maybe even could be somebody who could really help out. But it is hard, because to me, it's so simple. And then once you get it as a parent, you're like, why can't you just like do this for my child? Like, just do it.
Yeah, I will add, I just want to jump in for a second
Yeah,
and
please.
say, you know, everybody has their own journey and their own, they learn things at different times. And, you know, we all think, oh, it's 2020, so everybody's hip, and, you know, like, there's no more gay discrimination. There's no more, you know, same-sex couples can marry, and if you want to be transgender, you can. It's all cool and good, and we're all hip, and we all know. We don't. And I always say to kids all the time, adults are stupid. Give us a break, right? And you're going to be misgendered. You're going to be insulted. You know, you have to give people the benefit of the doubt all of the time. Assume that they're going to be wrong and they're going to say something dumb all the time. You know, someone says something dumb to me every single day, and I probably say dumb things too. So I want a break, and I want, you know, but don't assume that everybody knows. And clearly this is an example that somebody who approached the professional community and they didn't know what they were talking about. And I'm not surprised. I'm frankly not surprised. I just wanted to add one more thing that we're going to go over a little bit. We're not, the three panelists are not in a rush. So if you'd like to stay and ask questions, you can. We will go maybe to like 8:10 or 8:15. I don't want to go too much over that, but everybody's welcome to stay and ask a question. And again, if we do not get to your question tonight, please email me, lighthouse@kidsincrisis.org, and I will answer your question. Okay, another question. I'm pretty sure a student came out to me with the phrase, I have a sexual preference. They made it clear that it's not something they want their family to know, and they've suffered socially because of it. I want to follow up with them on this during our next session. How do I best bring it up? I want to honor the language they chose, for example, sexual preference, but I want to help them talk about it as it seemed they were having trouble fully coming out. I could be wrong. Perhaps the sexual preference is how they identify. Sorry if that's confusing. I am a social worker intern and have never worked with anyone in the LGBTQ community in this capacity. What are the 3 top podcasts or books, resources you'd recommend to someone who is new to trying to understand the LGBT community as a social worker? I can email you book references, but Michaela, do you want to?
First of all, great question, and we should put together that list. Yeah. I love that. And no, it's not confusing. I love that you want to honor their language, because I did specifically talk about how someone might not use the language, and that's okay, right? And at the same time, this person might be dealing with fear and internalized homophobia, which I would venture to guess probably is the case. However, you do want to go with their language to show them that, like, A, you're not scared of it, and B, you know, you also want to show them that you're not scared of what it could turn into at the same time. So you can share other types of language, just in such a way that it doesn't mean that whatever you share has to necessarily be what they identify with. So for example, you could say something like, so the last time we met, you brought up that you have a sexual preference. And when you shared that with me, it made me think, okay, this person probably has a preference that's not a heterosexual preference, because they probably wouldn't have brought it up with me. You know, like, you can be playful about it. You can be, that's fairly obvious. They might smile, they might laugh, you know, and at the same time, we could say, you know, do you know anybody else who is in, do you know anyone, I wouldn't say anyone else because they might not identify, do you know anyone who is in the LGBTQ community or identifies in that way? Is that something that resonates with you at all? You know, and you can offer it, but you're offering it off to the side in such a way that it's available, you're comfortable enough to bring it up, to speak with them about, that you're not afraid to talk to them about it, that you are a resource for them, and that they don't have to bite if they're not ready. So
Great. Awesome. Let's see. We are looking for a professional therapist for our 17-year-old androgynous child. They has a good support system, but needs some direction on how to respond to others who don't get them.
Oh, so it sounds like maybe becoming upset or distressed when someone doesn't use the right pronoun or things like that. Honestly, I mean, you may be good finding a therapist, although it may be very helpful to go to a group like Joe's or to go to a group like at the Triangle Community Center, like the one I run too, or both, because honestly, hearing from other kids who are like, yeah, that sucks, and sometimes you have to deal with it, sometimes is better than hearing from either of us. Like, yes, I can.
Hearing from the peers is more.
Yes, hearing from peers sometimes can be very powerful. I mean, sometimes they do need to hear from a therapist on this too, because I don't know the complexity of what's going on with this person. There might be other layers as well. Though if they aren't already going through, or they aren't already a part of a peer group, I would strongly suggest that to discuss this. So.
Yes. Yeah. Tell us about your group one more time. Like, what is it that you do at the Triangle?
So in Triangle Community Center, it's only twice a month, every second and last Sunday of the month from 3 to 4:30. It's transgender and gender nonconforming or gender questioning youth group. So unlike Joe's, which is like all LGBTQ youth, mine's just for gender. I mean, they're also probably sexual minority youth there as well, but it's focused more. It's 13 to 24. It's a very wide age range, but it works, and it's been working for a long time. So they just have to email me for the link. It's all Zoom right now, and just tell me like who they are and how old they are and why they want to be in the group, and then they can be in the group. So the CT Pride Center website, like Triangle Community Center, but CT Pride Center is their website. My email's on there, and they can just shoot me an email. The next one's on the 29th. And the every second Sunday of the month is the exact same time that the PFLAG, like the parent group, is as well. So yeah, and it's all free, and like, it's just a community resource. So
great. Okay. Let's see. Language is clearly. Go ahead. What?
Oh, I was just going to say, I saw something about Spanish, and I don't know anything off the top. Yeah, I don't know any Spanish resources off the top of my head. I think HRC developed some Spanish resources, so check out HRC. But I do want to check out if Lambda Legal created some resources, and some of the people who did the safe space stickers, if they created Spanish speaking ones as well. I would have to research that, but that's somewhere to start. And those are really important questions, because that is so needed. And I think
it is so needed. Yes.
So
yes, and we do have. We do have Spanish bilingual facilitators at Lighthouse. And we have bilingual kids as well, many of them. So we would love to. Yeah, we're equipped for that.
That's so good to know. That's so good to know. I love that. So I would like to find more resources, but that's what I have off the top of my head.
Okay, let's see what else. As a social worker leading groups for LGBT folks, how open are you about your personal identity? A lot. I'm an open book. Personally, I have a husband. We have an adopted daughter. I lay it out in the line, and I welcome one-time visits from open out adults who are successfully navigating life. you know, if you're interested in coming or interested in being an adult and being an adult facilitator, email
I'm interested
me
in being an adult.
Yeah, me too.
I'm not interested in that.
So yeah, email me at lighthouseofthekidsincrisis.org. We're always looking for good facilitators, and I'm always looking for, if you're an adult who would like to come and share your experience, we'd welcome that. But you know, I need to talk to you first. So what else? Again, Lighthouse meets on Tuesday nights at the Avon Theater from 5 to 6:45. It's open to all LGBTQ youth, 18 and under, 19 and under. Yeah, we used to call it a teen group, but now we call it a youth group because we're getting younger and younger kids. So yes, you're welcome to come. And if you're a parent who's coming for the first time, you are welcome to sit in on the group as well. And Lighthouse is meeting in person. We are meeting at the Avon Theater on Tuesday nights in downtown Stamford. It's right on Latham Park. So that's where we are.
And let me answer that question too, about the leading groups. So in terms of,
yeah,
I'm a little more relaxed with my youth group. But in terms of when I run like the LGBT group at Silver Hill, the clinical group, which is a clinical group, whereas the other one is a peer support group. Any LGBT group, I run it as they know my sexual orientation and gender identity. I'm a firm believer that when it comes to especially treating, when you're treating in a hospital a minority population who has experienced tremendous pain at the hands of hospitals, especially psychiatric hospitals in the past, they need to know that like you are safe. They should know that people who are not queer are also safe. However, like you are already sharing with them that you are based on that in a way. So when it comes to running an LGBT specific group, I do share that information about myself. I don't really share much in terms of like, and when it comes to more, like in terms of like having a partner and relationships and things like that, like the same as any other clinical group, like only as relevant. Whereas in a peer support setting, it would be a little more relaxed. So that would be to answer that question. And hi, Tammy. Tammy's one of the interns here.
You see this last question, Michaela? Michaela, does your group meet in person yet, or are you virtual?
No, it's virtual still. Like Norwalk decided because of the rates that they didn't want to open back up quite yet. So because it's not like just because it's not like a one, it kind of has to do with like the entire center, not just like a one group, whereas Joe is like operating with his one group. Like mine's a part of also a decision within an entire center. So unfortunately we have to like operate under that. And also, I mean, I also am so sick of video. Like I hear you. I much prefer to be in person, and there's so many pros and cons because there are some people who like would not have access otherwise. And there are also people who don't have access because it's video. So it's like, it's a mess, but unfortunately, yeah, not right now, but we'll like, maybe I'll add to my email list or something. You can just email me and then you'll see when we end up going back in person. So.
Yeah, and stay tuned. Lighthouse, as of today, is meeting in person. That could change. Stamford, obviously, COVID is a fluid situation, and we're abiding by Stamford city rules. So right now, we are allowed to meet and we follow strict protocols, wearing masks and you know, social distancing. But follow us on Facebook or Instagram. We're Lighthouse Strong, and on Facebook we're Lighthouse, a program of kids in crisis. So I always post on there. You can follow whatever we're doing, and if meetings are changed to virtual, I'll let you know through there. But again, I want to reiterate that anybody can email me at lighthouseofkidsincrisis.org. You know, any questions for Michaela, I will send them to Michaela. But I want to thank Erin. Thank you so much, and a shout out to the Ferguson Library. Your
Thank you guys.
support and help is amazing. We love you. Michaela, we love you too. Thank you so much. And we're going to have you at, we're going to have you come to Lighthouse soon.
All the stereotypes.
Thank you, everybody.
Thank you, everyone.
Thanks, everybody.
Have a great night.
Have a nice night. Bye-bye.
Bye.